Assalamu alaikum. You're watching Views and News and I'm Faisal Rehman live from our Islamabad studios. Today we'll be talking about a very important subject, and that is the coronavirus and the probability that it can affect Pakistan, though there are reports that there are about 18 cases overall, primarily in Karachi, 2 in Gilgit-Baltistan and 1 in Islamabad. But obviously a lot of people do have this kind of an impression that maybe there are more cases but we are not aware of it, number one. Secondly, when you look at whether we should call it an epidemic or a pandemic, but currently it's almost all over the world. You look at the figures in Italy and you'll be surprised that around 463 people died so far. I mean, this is the report around 16 hours ago. And the number of infected, we all know about that. Looking at the total number, it is believed that around 1,15,000 people have been infected so far, and out of which almost 4,000 have died. So that makes it around 4% of the total death rate, all those who were treated, and 4% deaths were reported. So primarily there was good news from China as well as from Korea, that in China around 60,000 people have recovered from this disease. This is the report which I got a little while ago. Now, looking at the kind of precautionary measures which Pakistan need to undertake, obviously there is a lot of problem going on in Iran also, in our neighboring country, where there are fears that the actual death toll is much higher, as well as the number of infected people, that is also pretty high. But the report says that still around 200 people have died and many are reported sick as well at the same time. So this is a continuous process. But what is this COVID-19? And then when we got to know that one person was discharged from the hospital, he was cured. Now, what sort of medicine was used? Do we have a vaccine for that? There are a lot of questions brewing in our minds for this particular issue. So we'll try to cover as much as possible in our today's program, primarily talking about the coronavirus, its effects, and the kind of precautionary measures we need to undertake, and also what should be done if somebody is found infected in the family. What sort of a precautionary measure do we need to take in order to stay away or survive, for that matter? To talk about this, we have with us in our studio Dr. Zafar Mirza Saab. Zafar Mirza Saab is the Special Assistant to the Prime Minister on Health Issues. Thank you very much, Dr. Saab, for taking out your time and talking to PTV World. So first of all, looking at the capacity and the magnitude of the issue, sir, how well prepared are we?
Thank you very much for having me. I'll come to the question of capacity and in view of the quantum of the problem. But let me first tell you that for once, Pakistan has done well until now. Pakistan was the last country in the region among its neighborhood to report the first case of coronavirus. And especially with China on one end and Iran on the other, India on the one hand and Afghanistan on the other, all 4 countries had reported, and 2 of them having frank outbreaks, and especially China, which was also the origin of this outbreak. So we were the last country to report this. Is it just coincidental, or is it speaks about something? What I can tell you is that in Pakistan this time we started timely, and we put in place simple public health measures to prevent a communicable disease outbreak. And the result is that not only that we were the last country to report the first case, but actually globally we were the 48th country to report the first case. And which were these 47 countries above us? These included United States of America and UK and Scandinavia and South Korea and almost all first world countries. So what differently happened in Pakistan? And people are asking this question, and here I would also refer to the point you made in your prelude, and that was that are we hiding anything? Are there more cases that we are not talking about?
This is a general fear, sir.
Of course, I know. So first of all, as a responsible cabinet member of the Prime Minister, let me dispel this impression completely and absolutely. Pakistan has 19 cases as we speak, and we have no other case in Pakistan at the moment. And as a public health person myself, who have spent at least 15 years in World Health Organization, this is the worst thing a government should be doing, to rolling under the carpet your problems, and in this case the cases of any disease, because that's just like shutting your eyes.
It's a viral infection, one has to be very vigilant. Yes,
very, very vigilant, and it is basically postponing the problem, and during this postponement the problem is becoming bigger and bigger. So it's one of the fundamental principles in public health, and especially in the outbreak prevention and control of communicable diseases, that we don't hide anything, and we should not hide anything. We will be shooting in our own foot if we do this. So I want to completely dispel this impression, whoever has this today, that Pakistan is not reporting, we are fudging with the data, we are not giving the exact figures. Absolutely wrong. Now, having said this, we should not be boasting unnecessarily about our capacity. We say man anam ke man danam. We exactly know that where we stand, and the gaps and the weaknesses and the institutional problems that we have, and the spending that we do on public health in general as opposed to other sectors over the decades, not years. So we exactly know that where we stand and where our weak spots are. But the point is that until now, the simple but thoughtful and based upon facts and experience, the strategy that we adopted and started implementing is giving us the dividends. So we very timely, for example, well, I'll come to the measures that we undertook later, but what I can tell you is that no country in the world can have all the resources which are required to a frank outbreak of a highly transmissible communicable disease.
But still there has to be something implemented.
So that minimal preparation that we should be having, we have been working very hard on it. We have developed a certain scenario based preparation for patients for testing, diagnostic ability, clinical ability, designation of hospitals, isolation rooms, quarantine SOPs, etc., etc., including also stockpiling for the personal protection equipment. But having said all this, as I said in the beginning, one can do these things to a limit, and our limits are, I mean, we hit our limits very soon.
Right. But sir, when we talk about the SOPs, there has to be a certain ideology in place that, listen, this is what we need to do. For example, recently I had a chance to visit your hospital PIMS as well as polyclinics, and honestly speaking, I did not see most people wearing masks. I'm talking about the staff here, not the general public as patients. Hardly anybody was using the gloves or something, and primarily, I mean, it seemed that, God forbidden, if something happens, people, they're not aware of the magnitude of the problem, and secondly, the SOPs, basic SOPs were not in place, sir. So don't you think there are certain things, for example, they should be made mandatory, that all those people, I'm not saying that shut down the schools or shut down the universities or close down the marriage halls for that matter, or say no to all the gatherings, but you need to sort of, educate your television medium, your social Facebook, or for that matter social media platform. It should be used to the optimum level to create awareness now that this is what you need to do. Cover yourself when you go out, wash your hands. I mean, this is what we've been hearing, but sir, a lot needs to be told.
Of course. With a country of such low literacy and general casual, I mean, we are generally casual in our approach.
Very casual, yeah.
Yes, I agree with you, but can you specify to me that what particular SOP you are talking about which was not there?
So, for example, in Sindh, we heard that now the schools, they were shut down for a certain time period, and then we got to know now, last night the minister said that they'll remain open, and we'll see what happens. Similarly, sir, there are so many weddings going on, people are not aware, you hug, you shake hands. I mean, these are the general things. And since the quarantine period is 14 days, a person could be perfectly fine apparently. No running nose, no sore throat, no temperature, nothing. And maybe it could be a career.
Since you mentioned hospitals, why I asked you which specific SOP you wanted, and you mentioned masks, that nobody was wearing masks. Nobody should be wearing masks. Actually.
Why not? Why
yes,
not, Doctor?
I explain it to you. I explain it to you. Our SOP for masks is very elaborate and based upon scientific evidence that everybody does not need to wear mask. Who should be wearing mask, which kind of mask, and when are the questions we should be asking. So, in this case, a normal healthy person who does not have any respiratory problem need not to wear a mask. So, then the question is, who should be? People who are taking care of positive coronavirus patients must be wearing a very special kind of mask, that is N95. And the patients themselves should be wearing simple surgical masks, and the reason for that is that the idea is just to stop when they sneeze or when they cough, nothing goes out and it does not spread. So, those who are handling coronavirus patients, it is absolutely essential that they wear not only the very special mask, but the full protection gear. But should ordinary people walking in streets and working in different organizational environments wear masks? No, we are not recommending that. We are not recommending that because it does not protect you and it does not protect others. So, it is a waste of money and creating unnecessarily optics which can create panic. What is going on here? Everybody is wearing masks. And I am not just saying this because I think, because one of the major problem in Pakistan is that everybody has their own thinking, and they say, because I think this is why it is right. There should be a scientific evidence on which you found your policies and strategies.
Okay.
So, what I have just told you is a strategy based upon WHO recommendations. So, I recently went to PIMS to that ward where these patients are kept. Although I did not enter the room, I was outside, and I was not wearing masks. I do not need to wear mask. So, we have actually issued an advisory, an official advisory by the National Institute of Health, and it is available on nih.gov.pk and it explains to you both in English and Urdu about the use of mask. So, but coming to the fundamental point that you were making, that our hospitals and their state of affairs and the general care that we must be exercising there with reference to infection prevention and control, or for that matter solid waste management or hospital waste management, yes, we have lot of weaknesses, I agree with you. Our hospitals are very overcrowded, and physical space even is not allowing the upkeep, the cleanliness, the hygienic practices in hospitals. We have major problems. But as far as the as far as the preparation for coronavirus, where we have dedicated isolation rooms where these critically ill patients must be kept, or patients must be kept as suspected patients unless their tests are done and they are proven to be having coronavirus. I mean, we are doing all right.
All right, now Dr. Sir, couple of points. For example, how well the staff is trained to sort of handle this kind of a problem. And secondly, also, since you mentioned about certain wards, are these the wards which are isolated on some sort of a corner? And on top, sir, if somebody is, for example, found that he has this coronavirus and eventually he's treated, and after keeping him in the quarantine setup, if he's let go after 2 weeks or so, can he get this virus again, sir?
Well, first of all, you said many things in your question. So I'll pick different points one by one. First of all, you said that if somebody knows that, come to know that they have a coronavirus, how would they come to know? That is the first question. There is no specific signs and symptoms of coronavirus disease. The three cardinal signs or symptoms of coronavirus are those which are actually very common symptoms in any respiratory problem, viral infection of your respiratory tract.
Even common cold.
Especially low respiratory tract. And these are, and if it is because of virus, then you have fever, and you have cough, and you have difficulty in breathing. Now, these are not very specific to any one disease, as you would imagine. So, how we come to know that the person has coronavirus? So, first of all, there is a case definition.
Okay.
And the case definition is that either this person recently has traveled from abroad and in last 2 weeks, and on arrival or during travel, this person has developed these three symptoms, then this person qualifies for a lab test. And the lab test is not blood test, unlike many people think that it's a blood test. It's not. It's a throat swab.
Okay, you just put it in.
Yeah, we just revolve a woolen, cotton with scissors, and it's a special technique to take a throat swab. And then that throat swab is sent to the lab, special labs, not every lab can do this. And they can do this through a technology called PCR, and there you, in about 4 to 5 hours, you can come to know that you are whether novel coronavirus positive or novel coronavirus negative.
All right. So this test takes around 4 to 5 hours. Okay.
And that's the only way that you can come to know that whether or not you have the disease. Supposedly, if you have the disease,
okay,
then what one should do? Now, here again another very important thing to remember, which people have come to realize after looking at all these cases which are happening, especially in China, because a lot of research is going on. Remember that this is a new virus. That's why we call it novel coronavirus. And of the novel coronavirus, this is the first ever outbreak which is happening. So we don't know everything about it. A lot is being learnt while managing it.
Okay.
So if, for example, a person has become positive, and then what everybody needs to know is that what we call fertility rate, or a case fertility rate.
And what is that supposed to mean?
Case fertility rate means that if 100 people get the same disease, how many will die?
Okay.
That's case fertility rate. The case fertility rate in this case is roundabout, is anywhere depending upon where you are calculating. If you are calculating it in Wuhan city, it will be 4-5%. And if you are, for example, here, if you calculate it here today, it's 0. But generally, globally, it's round about 2.
113,000 infected, 4,000 died.
Yeah.
3.8%.
Something like this. So it's actually very low.
As compared to SARS and MERS.
Yes. And even seasonal flu.
People say, sir, this is, this is a family basically. MERS is there, which was Middle East Respiratory Syndrome, and then you have the SARS, the severe acute respiratory syndrome.
We know.
Are they all linked?
Yes, yes. It's a family of coronaviruses. We already know 4 of them. MERS and SARS are 2 of them. and this is the fifth one that we have found. And this virus actually, if you look at what experience has told in last more than 1.5 months now, is that 98% of the people who developed coronavirus disease actually completely recover. Out of this 98%, it's around about between 5 to 7% patients who get severely sick, acute sickness,
Okay.
To an extent that they would be requiring definitely hospitalization, but not just hospitalization, critical care.
Okay.
And critical care means, in general terms, it means ICU, intensive care unit.
Yeah.
And a proportion of that would also require ventilators. But apart from this 5 to 7%, the spectrum of the disease in terms of its severity is actually very mild to moderate. In other words, majority of the coronavirus patients have mild to moderate disease. So then the question is, why we are so worried about it?
Absolutely.
Right. So before you ask me this, the reason is that its transmissibility from human to human is very high. So that's why it just spreads like a fire, and it causes a mass level mortality.
Even animals like cats and dogs can get this as well.
It actually was in animals, and we call it jumping the species.
Okay.
So which means that this novel coronavirus is supposed to have jumped from one species to another. So from some animal about which different names are given, but nothing is proven as yet, it has come to humans. So it is manifesting for the first time in humans in terms of causing infection, and which manifests through certain signs and symptoms. In this case, it is causing lower respiratory tract infection, and I have already told you about the signs and symptoms. So if a person has developed this disease and it is proven, then what should be done? For mild to moderate disease cases, actually, if we have large number of people who are having this disease, obviously there are limits of hospitals and facilities.
Absolutely.
So actually what is recommended is home isolation.
Home quarantine.
Not quarantine. There is a difference between quarantine and isolation.
Explain that, sir.
Yeah, I'll explain to you. But let me complete that thought first.
Please.
So what we recommend is that for mild to moderate patients, if they are properly in isolation, kept at home, and the family members or caretakers exercise enough protection in terms of dealing with that patient, that person, because it's a self-limiting disease, and we'll come to the treatment and the vaccine later. It's a self-limiting disease. There is no one specific treatment which exists.
It is believed that there is no treatment as such.
No such treatment. But like when we have Zukam or when we have flu, there is a saying in the lighter tone that if you treat it, you can treat it in 7 days, and if you don't treat it, you will be okay in 1 week. Because many viral diseases are self-limiting, even if you don't do anything.
Still, it is going to get cured at some stage.
So same is the case with this. So mild to moderate cases must be kept at home, but with necessary caution and necessary protection that the caretakers must be exercising. For critically ill patients, they must be in the hospitals. For both cases, if they are exhibiting signs and symptoms, basically the treatment approach is to treat symptomatically. If you have fever, take a medicine for fever.
Like normally when you go report sick and you go to a doctor, sir, he's going to give you antibiotics and a couple of other syrups or something. Syrups are like, they're also obsolete now. Primarily, it's the antibiotic.
Yeah, in this case for viral infections, that's not the first line of medicine. for viral infections, because for viral infection there are antivirals, not antibiotics.
Okay.
But sometimes there is a comorbidity. You also develop a bacterial infection once your immunity goes down, so then we give also antibiotics. So, in this case you basically symptomatically treat the person and the person will gradually recover. Just to give you an example, as I think you mentioned in your introduction that out of all the declared positive patients, confirmed positive patients in Pakistan at the moment, which are the total number is 19, in reality they are 18. Why I say this? Because 18 are still patients, one of whom who was actually admitted in a hospital has been discharged because he completely recovered. So, as I think you also mentioned, 60,000 people have recovered in China alone.
Yes, yes.
So, the recovery rate is also good. So, the point is that if one does not panic and try to understand that what this disease is, how it manifests itself, what are the signs and symptoms, how we can prevent and control it, few basic things, and you can actually prevent its spread. And what happens is that the common sense does not become common practice, and that is where the problem starts.
All right.
So, for example, if you see a person who has a runny nose and a running fever, you do not need to repeatedly hug that person or always have shake hands or sit too closely with that person. Wash your hands if you touch things around that person, keep safe distance, take care of your nutrition, take care of your hydration, simple things. If we just start doing these things, we can actually effectively, human beings can control effectively the spread of the disease.
Now, they are very, as we say, the desi totka. Somebody said that, take 7 cloves of garlic and boil it with 8 glasses of water and then eat it and drink it. Or maybe have a lot of vitamin C, have loads of oranges. But it's one thing which is very, very common. I mean, we have noticed, and this is a reported case, in fact, that people with low immunity, like children who got infected, recovered like this, whereas people over 60 could not. So, how about the immunity? I mean, is it about the age, sir, or vulnerability? Let's talk about that.
This is the pattern which has been observed in this case is that it has, I mean, the virus has affected more aged population. So, 50 plus people are more affected, children are least affected, and young people are least affected. So, which explains that lower immunity makes you vulnerable to the disease. The other thing is that for many infectious diseases, you also, over the period of time, you also develop vaccines which can provide you protection. So, for example, we give our essential vaccinations to children against 10 diseases, right. So, basically the idea is that you protect them. Vaccines are given to healthy people, not to the sick people, so that they do not become sick. But as far as that, so there is no vaccine at the moment, there is no specific treatment available at the moment, but a lot of research is going on, and it seems like that vaccine will become available in next couple of weeks, and medicine, it's anybody's guess. Different existing medicines are being tried in different combinations, and some of them are showing some results, but it is not good enough to we start recommending them. You asked about quarantine and isolation, and I skipped that point. Let me come to that. Technically speaking, quarantine is not for sick people. Isolation is for sick people.
Okay.
Quarantine is for healthy people, but healthy people who have returned from an area where there was other diseased people.
They were more vulnerable there.
And you lived among them, and there is a chance that they transferred that virus or bacteria into you. So, every disease has a incubation period. So, when you come back from that area to an area where this disease is not as that prevalent, so you are kept under observation as a healthy person for that incubation period, because if you are going to develop signs and symptoms, so that you can be immediately taken to the hospital. Quarantines are not hospitals, they are basically like rooms, places with separate rooms where people can live like in a hotel or in a
but
hospital.
what if one is carrying the virus and, for example, 10-15 people are living in a house for that matter, let's call it a quarantine. So what if one is sick, rest 7, 8, 9, 10, whatever the number is, they are not? Don't you think that is also very vulnerable? I mean, that
possible. In quarantine,
because this is what is happening out there, sir, on the border. I mean, the pilgrims who are coming back. And
well, I'll explain that to you also, how we are controlling that. That's more important to know. But yes, you are right theoretically that in quarantine, if a person is kept and he or she is not having any signs and symptoms, or if or a patient who has signs and symptoms, they can spread to others, and that is why I was emphasizing earlier that those caretakers must take necessary precautions to protect themselves from that spread. They need to wear personal protection gear, they need to wear a special mask, etc., because that is where you are vulnerable, that is where you are most vulnerable to get the disease. But during quarantine, if you start developing signs and symptoms, then you are isolated from there, so that you do not spread that disease to others, right. So, you are taken from there and you are put in a hospital setting, because now you are exhibiting signs and symptoms. In quarantine, everybody is healthy until a point that you develop signs and symptoms. If you start developing, you are taken away from there, so that you do not spread to the others. So, often people confuse quarantine with the isolation. Isolation is usually in hospitals, and the quarantine is for example, the Chinese who were coming back after spending their New Year in China, working in Pakistan, they went to China for New Year celebrations. At that time, there was this outbreak started happening there. Now they had to come back. They were not sick, they were healthy, but they had to come back to their place of work in Pakistan. So, Pakistan and government of, I am explaining this to explain this phenomena. So, government of Pakistan and government of China agreed that government of China will not allow these Chinese to come back to Pakistan unless they are put under observation for 14 days, because 14 days is the incubation period for this disease.
okay,
right. So, if they have spent those 14 days and there was no signs and symptoms, this means that they are not carrying that virus. So, then they were screened at exit, then they were screened by us while entering, and then they were allowed to enter because they are healthy people and they are proven healthy.
Now, sir, what about those Chinese? Because a lot of Chinese live in Islamabad. There are so many companies registered by the Chinese in Pakistan in general, sir. And you see, I mean, I think Chinese are the most accepted foreigners in Pakistan. I mean, you'll see them everywhere. Any Chinese who's been working in Pakistan went back for the New Year's, or any report? I mean, are they under some sort of a supervision?
Many went back and many came back, but they came back on this condition that I just explained to you. They spent 14 days in quarantine there.
Okay.
And when they were proven healthy, only then they were allowed to travel. And when they reach here, just to top it up, we also developed this understanding with the Chinese embassy here, that they will also make it mandatory for them to spend another 14 days here in
another quarantine
in their homes where they are living, but they will not they were not allowed to rejoin their jobs. So that they do not mingle with others, and if they are still, so it was just a extra caution. So, actually, as a result of this, now this will explain you something very interesting. Among the 19 cases that we have today in Pakistan, each one of them has a recent history of travel to Iran.
To Iran, everyone almost.
Almost everyone.
So this is what we got from the western side rather than from the northeastern side.
And why? One may ask why. Precisely because of this reason that they are quarantined there from China. Although China is the hub of the disease, it originated there, maximum cases, maximum deaths. But the hub was Wuhan and Hubei.
Correct.
Outside Hubei, people were allowed to travel and all that. But the government of China still made it mandatory for all Chinese that if they are traveling abroad, they will spend 14 days. What a very nice thing to do by Chinese government, to make it mandatory for every Chinese before traveling out of China, so that they do not spread it to other places, they will have to spend 14 days under observation. And this is precisely the reason that we do not have a single patient of coronavirus in Pakistan which has a travel history to China. 19 out of 19 have travel history either to Iran, maximum of them, few from Iraq and Syria, and recently 3 from UK and Dubai. They came from UK, a family came from UK and then they stayed in Dubai and they ended up in Karachi and they were found positive.
So these were primarily the pilgrims?
The Iraq, Iran, Syria, all pilgrims, but this was a family visiting Pakistan. So that explains something very important. What I was earlier saying, there are simple precautionary measures, simple public health practices. If they are put in place, countries, nations can avoid outbreaks.
Now, sir, there is another general consensus. I mean, a lot of people believe that the moment the temperature is going to rise, things will be fine. So let's explain that also, sir. Do you think that, let's say by the end of March or the beginning of April, things would be much different?
It's more of a wishful thinking, I would say, at this stage, because as I said, it's the first time that this virus is causing a outbreak of global.
So we are learning as it
we are learning
comes.
as we are moving, but likely, I would say with hesitation, that it may happen, because if you see even now, the countries with cold weathers have more prevalence than the hot countries. So one can wish that with rising temperature in coming weeks and months in Pakistan, and this will go down. But at the moment, this will first time go down, because it has never happened before. So we cannot say for sure that it will definitely going to happen, but it's likely.
But say, look at the way it has hit the global economy. I mean, you start off, we were doing a program on coronavirus, its economic impact. Interestingly, it's $47 billion a month, only in tourism, 30 billion out of which was because of the airline industry. Look at what Emirates has done. They have shut down their flights to so many areas, and on top of that, I mean, nobody's going to Milan for that matter. PIA's direct flight has been. These are the precautionary measures. No football matches, no public gatherings. I mean, these are the actual SOPs they have put in place.
Yeah.
I mean, though the magnitude of the issue is much higher, but don't you think, sir, a country like Pakistan, which is a third world country, minimum resources, less education, and so many other, I would say, negative indicators, to put it this way, we need to be super careful. I mean, I'm not saying that people should start wearing masks and start wearing gloves on the roads, but generally, sir, because since this is the last question for you, sir, what would you recommend to the general public, sir?
Well, you're very right, and I totally agree with you. We have to be extra cautious. Our economy is not ready to take such a hit, and actually World Bank has already calculated the possible impacts on national economies, and they will be huge. So economy is one thing and the human misery is another. So for both reasons, What needs to be done? What needs to be done is, first of all, that at two levels we have to act. Government has to act in terms of putting in place certain SOPs, guidelines for management, for prevention and control of this disease, possible disease and outbreak, which includes also awareness raising, and as you were earlier saying, massive awareness raising campaign. So that's one level, macro level, policy level. The other thing is a personal, taking personal responsibility for your own self to begin with, and people around you.
All right.
So first of all, what I say at this level is that first understand what are we dealing with. Don't get into panic. Try to understand and make other people understand that what is it. For example, how many of your viewers would be knowing, before I just spoke, that 98% of the people who even develop this disease completely recover. This is a very reassuring figure, isn't it? So understand it and understand it through reliable sources of information. World Health Organization and CDC provide you good information. In your in Pakistan, NIH website is very good. And secondly, become more careful. I have already given you the case definition dimension, that if you have come from outside, traveled recently, or you know somebody who have traveled recently, keep a safe distance, keep an eye on them, and then personal hygiene.
I think
wash
that's
your
the
hands,
key. Keep yourself clean.
Yeah, exactly. And do not get too close to people who have these signs and symptoms. Wash your hands repeatedly, because this is actually most
This is going to work well, sir.
Yeah.
And use the hand sanitizers also if they are available. Anyway, Dr. Saab, that was a pleasure having you, and thank you very much, sir, for informing us and our viewers about this problem, sir. But anyway, that's all we have for this hour. I'll see you again. Till then, you take good care. Khuda Hafiz.